Shiv could have better handled this situation by initially asking the attending physician to utilize the services of a qualified medical interpreter in order to properly communicate with the patient. Even though the attending made the biggest mistake in this situation and Shiv was trying to help as best as he could, he is not qualified to act as a medical interpreter under these circumstances. The Department of Health and Human Services, HHS, establishes competencies an individual must have in order to be a qualified interpreter. These include knowledge of specialized terminology, knowledge of interpreter ethics, and skills to effectively and impartially interpret. The HHS clearly states that the fact that an individual has above average familiarity with speaking or understanding a language other than English does not suffice to make that individual a qualified interpreter for an individual with limited English proficiency or LEP. This would apply to Shiv because even though he could speak the patient's language, he did not properly demonstrate knowledge of specialized terminology, ethics, or impartiality in the exchange. The communication between Shiv and the LEP patient did make the patient more comfortable, but it was an inappropriate use of language services because a lot was still unclear to this patient. In the United States, patients with LEP have the right to access healthcare in their preferred language, according to Title VI of the Civil Rights Act of 1964. Both the attending physician and Shiv disregarded the Haitian patient's right to access language services by not providing complete translation or interpretation of their entire exchange. The attending physician also failed to receive informed consent from the patient before conducting a skin evaluation of the breasts. The American Medical Association's Code of Medical Ethics states the process of informed consent occurs when communication between a patient and physician results in the patient's authorization or agreement to undergo a specific medical intervention. The attending should have had a qualified medical interpreter obtain consent from the patient before he partially undressed her. And this took away the patient's autonomy and made her obviously uncomfortable. At this point, Shiv tries to step in, but even if he had properly interpreted the whole time, the AMA's ethical code of informed consent would still not have been met. The situation is also a conflict of interest for Shiv because he presents himself in dual roles as a clinician in training and possible interpreter. The attending physician has some degree of power over Shiv's career, so Shiv most likely did not want to upset the attending by initially suggesting the use of a qualified medical interpreter. If Shiv was not worried about how his actions may affect his career, he could have further prevented the patient's harm. There were many mistakes made with this case, but Shiv should have been more proactive by initially suggesting the use of a medical interpreter in order to respect the patient's right to access healthcare in her preferred language, despite the malpractice his attending was demonstrating with this LEP patient.